Well, I'm here with Addie Link to talk about COVID-19 and try to separate some of the facts from some of the fiction. And there's so much information on the topic, so many different sources of information. There's good sources like the CDC or maybe the World Health Organization, and then there's bad sources. You've got the internet and conspiracy theorists, and you hear different things in the local news and the national news. And besides the fact that there's so many different things being said, the actual facts continue to change. And what was true last week may not be true today. And as time progresses and we learn new things about this COVID-19 disease, the facts change. And so I thought that our people, allied people, would like to know what we think the facts are. And I appreciate Addie agreeing to speak with me. Addie is Addie is not an expert. She's not a COVID-19 expert. In fact, she wanted me to make sure that people knew she doesn't think of herself as an expert, but she does pay attention to the sources that we use to create the policies that we're creating. So I'm going to ask Addie some questions, and she's going to give us some answers as she understands them, and hopefully we'll all learn something. So. Thanks for being here, Addie.
Thank you. Well, just as you mentioned before, none of us here are experts when it comes to COVID-19, and we rely, like everybody else, on good, reputable resources. That would be the Center of Disease Control, World Health Organization, and many local agencies, such as the Columbus Health Department and the governor's announcement. And then as an employer, there are other considerations when it comes to recommendations that are more of legal matters or, labor laws, things like that. But I think it's always good to remember that, we hear of new studies and conclusions every day, whether it's on the local news or on the internet. And, we have to remember that information is... We have to consider the sources. Good studies are hard to really put into place and require really good data and resources, accurate data that is not available to many. So I think we just really should stay focused at this time on the CDC and World Health Organization.
Good.
I think what is so confusing to many of us is in the beginning we were told to just look for fever, a cough, and shortness of breath. So we thought it was pretty simple to identify this. As time went on and more cases came up, we now know that the majority doesn't have any symptoms or very, very mild symptoms. And then there's just common symptoms such as headaches, sore throat, body aches, muscle pains, vomiting, nausea, diarrhea.
Sounds like it could be anything.
Runny nose, exactly. And then, of course, one that has come up even more so is the sudden onset of the loss of smell or taste, which also can have many other reasons as well. So who does not experience one of those symptoms, maybe even on a daily basis?
Yeah, that's true.
Well, at this time, it remains to be unknown to what degree somebody can achieve immunity once they have had COVID-19. We know of other diseases, for example, measles. If you've had it, you have achieved immunity, or you have had the vaccine. With COVID-19, it is simply unknown. We still have to wait for additional studies. And it would really be a false sense of security for one to think, I've had it, now I'm okay, because they may still get it, and even the symptoms may be not as severe as they've had the first time around. They still could be possibly infectious to others.
Well, I noticed that the people that have had COVID-19 here, they tend to be the ones most careful with their PPE when they come back.
Yes, they are.
So they at least don't think that they're Teflon to it.
Yeah. Even early on, the CDC did not really recommend necessarily wearing a mask for everyone. It just, with many more cases and additional studies, they found it to be essential to avoid the spread of the virus. So we now know it is a big part of our lives right now. And in other countries, they may be more familiar with wearing masks. For us here in the United States,
Very
it's
strange.
still a very strange thing to do and to get used to.
Yeah.
Now, most of us here at Allied that work in the plant or are part of the respirator program,
Right.
of course, wear these P100,
Right.
the half-face respirators
Right,
with
right.
a P100 filter. And these absolutely provide excellent protection for the person wearing it.
Yeah.
However, since there's an exhalation valve,
Right.
it does not necessarily protect others because
Right.
droplets can still escape.
Right,
But
right.
they provide great protection for the person wearing it. Then we have, many know the N95s. They can also come with or without an exhalation valve. Those are primarily worn by healthcare professionals at this time. They also provide a very good seal, such as the half-face respirators. So, and they have a 95% protection. So these are very good to wear as well. Then we got surgical masks. And even though they're open and don't provide a very tight seal, they're still an excellent barrier for respiratory droplets.
Right.
And some people find these more comfortable to wear since they are lighter
Yeah.
and than any other respirator. And then we're all now very familiar with our cloth masks, which provide also excellent, very effective protection because it avoids against respiratory droplets to go out.
But so if we're both wearing one, we're both protected. I'm protecting you and you're protecting me.
At this time it
Yeah.
is. What's important to remember though is what's causing the spread of the virus is people that are positive.
Right.
They are the ones spreading the
Right,
virus.
right.
So as much as we want to protect ourselves, and that is very important, it is even more important really for people to wear a mask because every one of us could possibly be COVID positive and just be asymptomatic.
Yeah, that's an excellent.
So that
excellent
is
point.
how it spreads. And to avoid the spread,
Yeah.
we just have to imagine we are
Yep.
ourselves the
Yeah.
carrier.
That's a great point.
I think hand washing is still the most simple and most effective way to really avoid any pathogens, to get any germs off your hands, bacteria, viruses, especially before you eat, after you sneeze or cough, when you're preparing foods, when you touch animals, after using the restroom, or when you come in contact with newborns or the elderly. When I was growing up, the first thing when we came home, my mother would say, go wash your hands with soap and water. So she was right. She knew that long time ago that was very important and very effective too. And we should remember you have to use soap in order to really wash your hands and get rid of germs. You have to use soap. Water alone will not do the trick.
Yeah.
The soap is what the germs or viruses will bind to and allow it to rinse off your hands. And it should be about 20 seconds.
Yeah.
You know how they teach now kids in kindergarten to sing either happy birthday a couple times while they wash their hands.
Really? Oh, interesting. I know my grandson, every time he goes to the bathroom, I asked him to wash his hands. He said yes. I said, you use soap? He said no. I said, well, go back in there and use soap. So.
Yeah. Well, remember, it's not just the COVID-19 virus. We're thinking of salmonella. We're thinking of hepatitis. There are many other viruses that are out there that we want to avoid. Well, the CDC does recommend to use hand sanitizers that contain at least 60% alcohol, but it really doesn't replace washing your hands well with soap. They are good in addition to or in between. If you kind of watch people when they use the hand sanitizer, You pump real fast, and you really just rub it between your hands. You don't go between your fingers, your thumb, or the top of your hands. It is so there still remains a lot of might still remain on your hands.
So it's a great help, but it's not the answer. It's
Yes,
not washing your hands.
Well, an elevated temperature is only one way for us to identify if there may be a reason for concern, if somebody might have an infection. And normal temperature, 98.6, 100.4, considered a fever. We were thinking that a rectal temperature is the most accurate temperature, not very realistic at a
Tough to
place
do
of
every day here.
employment. So when you take an oral temperature, you get a reading that can be up to a whole degree lower than a rectal one.
Oh.
If you take it under the arm or forehead, it could be yet another up to 1 degree.
Interesting. Oh.
So I think early on we were just trying to be extremely cautious and try to make sure we don't miss anybody who possibly could have an infection.
Right.
But we can certainly reconsider. For many, 99 might be a very normal temperature.
Yeah. Well, it seemed to work so far. So
We have not had any elevated temperatures for quite some
Yeah.
time.
I think, honestly, I think one of the one of the outcomes of this whole COVID-19 experience is I think we're going to have a healthier workforce, because if you're come to work and you're sick, you're going to go home. We're not going to tolerate. I'm one of the worst offenders. I'd have to have pneumonia and be on my deathbed not to come to work, but not anymore. It's not going to be like that anymore.
Correct. And we don't use the temperature to diagnose anyone.
Yeah,
It
right.
simply
It's an
helps us
indicator.
identify a possible
Yeah, I understand.
infection
Yeah.
and to see which direction that might go.
Yeah, I understand.
Well, the CDC continues to state that it is thought that the primary transmission is between people through respiratory droplets.
Right.
And some direct or indirect contact with surface, if then, you touch your face. However, primarily they still think it is through respiratory droplets between people. Now, medical staff, maybe in hospitals that performs a lot of medical procedures, such as intubations or breathing treatments, those droplets could very well become more airborne and remain in the air. And right now, you read that it is thought could be up to 3 hours, possibly, but I think a lot of more studies need to be done.
Yeah.
And that's what they also say. More studies are needed to really be certain.
Yeah.
And it is, there's a lot that we don't know. The CDC still recommends, or that people can sit within 6 feet apart without protection.
Right.
So that's right now we have to go by.
Yeah.
I think a lot of it's unknown.
Yeah.
Well, again, the CDC says it is a possibility, but not thought to be the primary or the main way of spreading the virus.
Okay.
So they do know different viruses live on different surfaces for a different amount of time.
Yeah.
Paper, less time, minutes to hours, versus different type of metals up to days. But they still do not believe that this is the main way of transmission. So
It's still breathing.
breathing is still thought to be number one. So it does. We still should clean our surfaces, absolutely. And again, wash our hands. Try not to touch our faces, which I know is hard to do.
Very hard.
But now that we're respirators,
it's easier.
we're less likely to touch our noses and mouths.
Yeah.
Well, the time from exposure to showing first symptoms could vary right now. They say between 2 and 14 days.
Oh, wow.
So most people show symptoms within the first week.
Yeah.
However, it could be from 2 days to 14 days is what it is thought to be right now. You could, absolutely, especially if you get tested, for example, very soon after your exposure, within days, you could show negative.
Really?
However, you could still develop symptoms up to
Yeah.
14 days after your exposure.
That's kind of scary that you wouldn't, that once you've been exposed, it'd be nice if you could test and be tested positive or negative right away and know the answer, but that's just not the case.
Absolutely, but that's why it is recommended. Continue to watch for symptoms and continue to, especially that person should truly wear a respirator.
Yeah, absolutely.
Just in case.
Yeah, absolutely.
You know, early on that was thought, they commented anybody who shows symptoms, but they do know now that somebody can be infectious even if they do not show symptoms.
Really? That's interesting.
Or even 2 days before they start showing symptoms.
Interesting.
So you can be asymptomatic or pre-symptomatic and still be infectious. Now, to what degree, that is not known yet, but...
Yeah.
Well, those suffering from heart disease, any diabetes, chronic kidney disease, any type of respiratory conditions, COPD or asthma, severe asthma. Also, people that are obese are at a thought to be at a higher risk. People with sickle cell disease. Anybody who really has a lower immunity due to whether it might be chemotherapy or other health conditions that are included. Well, for one, we updated our respirator policy that requires all of us now to wear our respirators on Allied property, inside the building as well as outside.
Right.
And about 100% of the time, with a few exceptions.
Yep.
We also have ensured that the break area, the lunchrooms, tables are apart, allows people to have a more distance from each other. We avoided big crowds. We now have most of our meetings take place on Teams. We allow people to work from home, have different schedules. We made hand sanitizers readily available throughout the plant.
That was really early we did that.
Very early, yes. And along with providing any kind of cleaning, sanitizing material to clean their own workstation. So everybody has a little bit of a responsibility at this time. We also have protocols in place for what if somebody tests positive. How do we treat those situations? And as I mentioned, we now have a big role ourselves in keeping each other safe. So as far as temperature taking daily, if your temperature has not been taken within the first 15 minutes of arrival time, we now have different stations where you can have your temperature taken. This is now more important than ever since we have more and more people return to work on different schedules. We try to catch everyone in the mornings at their workstation, but that's not always possible. So please take responsibility. There's no denying that this ongoing pandemic influences people, and everyone reacts differently to stressful situations. Our focus is always on all the negative. And whenever we lose control over a situation, it makes us very impatient. I think I would like to encourage everyone to look for the things that they can do, the things they do have control over. We can choose to wear our respirators to help end this pandemic. We can choose to keep in touch with family and friends and not feel isolated by using today's technology.
Absolutely.
It doesn't replace hugging and spending time together, but it is doable. We can choose to really rely on reputable websites and not allow social media to take such control over us, which I think really is the main reason people feel so anxious and so
Yeah.
fearful.
Yeah.
It is important to stay informed, but not be, allow that to be too much of their lives. And we can we can choose to take better care of ourselves.
Mhm.
This is an eye-opener when we hear those with a low immunity
Yeah.
or at a higher risk. Some conditions are pre-existing and we
Mhm.
cannot do much about it.
Mhm.
But in general, we all can do something to
Right.
improve our physical
Yeah,
well-being.
absolutely.
Simply by better nutrition. We know that already.
Mhm.
By better sleep
Mhm.
and by exercising,
Yeah,
things
yeah.
like that. So try to focus on the things that you can control somewhat. We know that Allied has many resources for those that feel they do need some support.
Mhm.
We have the Employee Assistance Program
Mhm.
that can offer counseling of different types, whether it is for mental health or financial aids or things like that. So that is available to all family members as well.
Yeah.
So I would encourage them to reach out if anybody does need assistance like that. And stay positive.
Yeah. I appreciate your time. When Addie used to work for Dr. Cunningham, who was the doctor that Allied used for physicals and for different things, and when John retired and Dr. Cunningham retired, he said, I'd really like you to hire Addie. And about that time, I think we were going to hire Addie, and then we had a recession, and so we couldn't hire her, but the recession was over, and we hired her. And to this day, I tell people you were one of the best hires I ever made, because you do so well with our plant people, I think, and our people in general. I think you give people a sense of calm by your being here, and so I really appreciate the time you spent this morning on this, and I think people can learn something from it. So thank you.